All right, you guys, we're making our way through these SCCM guideline updates. What's up, you guys? It's your ER pharmacist, Lil Pharma. So the next one I have for you is on methylene blue. So I don't know if you guys have ever heard of methylene blue. There's a lot of misinformation going around the internet about methylene blue, but a lot of times we use it for not a lot of times. Sometimes we use it for refractory shock in the ICU. So we don't see this in the ER that much, but when I used to work in the ICU, we used it a couple of times. So the recommendation for adults with refractory septic shock and escalating vasopressor requirements, there is insufficient evidence to make a recommendation on IV methylene blue. So although it may improve blood pressure, there's insufficient evidence to determine its use as rescue therapy. So they do make a little caveat that in patients who are likely to survive the shock state, that it may be beneficial to kind of use it as a Hail Mary, which I think is how we're doing it already, in my opinion. Again, we don't see this in the ER at all, but when I used to be in the ICU, that's what we did, was just kind of like last resort. We would throw methylene blue at the patient to see if this would help. So that's the new recommendation. They're not recommending using it by any means. There's insufficient evidence. So maybe one day we'll have a study that indicates the use of methylene blue. But at this point, that's the recommendation. All right, we'll keep working through these. Stay tuned.